Medical news from MedRxiv. Identification of implications of m6A regulators and autophagy-associated genes for prognosis in ovarian cancer. A groundbreaking study has identified a link between the dysregulation of m6A regulators and autophagy-associated genes and the prognosis of ovarian cancer, revealing a potential new approach to predicting patient outcomes and guiding treatment decisions. This finding matters because ovarian cancer is a devastating disease with a high mortality rate, and understanding the molecular mechanisms that drive its progression is crucial for developing more effective therapies. The discovery of a connection between m6A regulators, autophagy-associated genes, and ovarian cancer prognosis has significant implications for the management of this disease. Ovarian cancer is a major public health burden, with a significant disease burden and high mortality rate, and despite advances in treatment, the prognosis for patients with advanced disease remains poor. Previous studies have highlighted the importance of understanding the molecular mechanisms that drive ovarian cancer progression, including the role of epigenetic modifications such as m6A, but a knowledge gap has existed regarding the specific implications of m6A regulators and autophagy-associated genes for patient outcomes. This study was needed to address this gap and to explore the potential of m6A regulators and autophagy-associated genes as prognostic biomarkers in ovarian cancer. The study employed a comprehensive approach, utilizing univariate, multifactorial, and Lasso-Cox regression analyses to screen for genes with prognostic value, and verifying the expression of key genes in clinical samples using real-time fluorescent quantitative polymerase chain reaction (RT-qPCR). The analysis included all 23 m6A regulators, which were found to be significantly differentially expressed in ovarian cancer tissues, and identified 10 key genes associated with both autophagy and m6A. A risk score was constructed and a nomogram was developed to forecast the prognosis of ovarian cancer patients, and the study also used single-cell RNA sequencing, scRNA-seq, to confirm the association between specific genes, including PLK2 and LEPR, and tumorigenesis. The key results of the study showed that the 10 identified genes were significantly associated with patient outcomes, and that the risk score constructed from these genes could accurately predict prognosis and susceptibility to anti-cancer drugs. The study found that patients with a low risk score were more likely to benefit from immunotherapy, highlighting the potential of this approach to guide treatment decisions. The analysis also revealed that the expression of specific genes, including PLK2 and LEPR, was associated with tumorigenesis, and that these genes may play a critical role in the development and progression of ovarian cancer. Secondary findings of the study included the identification of specific subgroups of patients who may benefit from targeted therapies, and the development of a nomogram that can be used to predict patient outcomes based on the expression of key genes. The study's results have significant implications for clinical practice, as they suggest that the assessment of m6A regulators and autophagy-associated genes may be a useful tool for guiding treatment decisions and predicting patient outcomes in ovarian cancer. The study's findings have important clinical significance, as they highlight the potential of m6A regulators and autophagy-associated genes as prognostic biomarkers in ovarian cancer, and suggest that these genes may play a critical role in the development and progression of the disease. The identification of a risk score that can accurately predict prognosis and susceptibility to anti-cancer drugs has significant implications for guiding treatment decisions and improving patient outcomes. However, the study's results should be interpreted with caution, as the analysis was based on a limited number of samples and further studies are needed to validate the findings and explore their clinical significance. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.